You are watching a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 25 years, please visit www.appcho.org.
October 1st, 2013 marks the day in which healthcare providers and other agencies will begin enrolling individuals without insurance into health insurance exchanges as part of the Affordable Care Act. With less than 4 months away, these organizations, including community health centers, are putting into place outreach and enrollment programs to help ensure that scores of Asian Americans, Native Hawaiians, and other Pacific Islanders across the country can get health insurance. This podcast series, which will include perspectives ranging from federal agencies, healthcare provider staff, and policy advocates, will attempt to shed some light on the issues and challenges facing healthcare providers as they prepare for this October 1st enrollment deadline.
Abbie Zahler, Health Advocacy Manager at International Community Health Services, or ICHS, in Seattle, Washington, talks about some of the challenges their community health center will face in preparing for ACA enrollment and outreach, and how their organization will be overcoming those challenges. Abbie, what is the biggest challenge you face in conducting outreach and enrollment for the patient population you serve?
I think that trying to reach all of the diverse Asian Pacific Islander communities in Seattle and King County with the limited resources we have is the biggest challenge. ICHS currently has some funding on its way to help support our efforts to provide outreach and enrollment, but with the limited resources, it's going to be challenging to both reach the sheer number of people who will need assistance and ensure that we can staff the appropriate languages so that we're providing the most comprehensive and culturally appropriate information on the health benefits exchange as possible. We also have sort of limited information so far on what kinds of training our staff will need to assist with enrollments, and limited information on the insurance plans that will be available. So we just anticipate that it's going to be complicated to help our communities navigate this new system.
And can you speak to the challenges of conducting outreach and enrollment in the different Asian languages that are spoken by your patients?
Sure. I know that we'll have some hard copy materials in some of the languages we serve, but the website to enroll in Washington State will not be available in any Asian Pacific Islander language or dialect. And this is challenging for us from a human resources perspective, mostly because it means a greater need for hands-on help to assist people in enrolling. And I think that's going to be true for communities beyond the API community, but without having that language access on the website, I think it presents a different kind of challenge. And it's also not going to be possible to have materials in every language we serve. It's just not feasible. So there's always going to be some smaller communities who lack even more information about the process. And unfortunately, these are the same communities that, due to their small size, just have a more challenging time accessing healthcare information and services in general. So that's something we're concerned about and trying to be cognizant of.
And given these challenges that you've just mentioned, how do you work to overcome them?
ICHS has a long history of providing comprehensive and culturally appropriate care to the API communities, and we'll continue our commitment to finding new ways to convey information and engage our communities. I think our first line is always our eligibility staff in the clinic, who are already really engaged in making sure our patients have access to the insurance and state plans that are currently available, and they'll be trained so that they're poised to assist patients as they walk in the door on the new system and new insurance plans as well. We've also long employed community health workers, or CHWs, who represent the communities they serve, are out in the community. They're trusted sources of information and sort of a bridge between the community and the clinic in a lot of ways. And they'll be trained and well-versed in the health benefits exchange also. We really want to make sure that as soon as patients and community members encounter an ICHS staff person with questions, they can get them answered without being passed off to somebody else. So we're just trying to be as comprehensive as we can in getting the information to our staff. And then finally, with the limited funding we are going to get to help with this, we'll be hiring staff positions that are a hybrid of our current eligibility and community health worker staff. They'll not only be able to walk patients through the new system, but they'll be connected to the community through our CHWs, be able to work through our existing outreach networks to provide the appropriate information to the folks who need it.
Abbie Zahler, thank you for taking the time to talk to us this morning.
Sure, no problem.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.com/AAPCHO And tune in for our next podcast at www.apcho.org.